but yeah, at the end of the day, you need to get all the nutritions, because someone who's not having a healthy meal, you can literally tell the difference for someone who's having a healthy meal. So yeah, it really affects your brain functioning and all that. And then your sleep and emotional regulation, the most important thing, I would say. There was a time I would go to bed at, like, I would still at this day, I would take and like the whole 8 hours asleep. And it really affects, like, if I'm only like sleeping for maybe like 4 hours or 3, that really gives like a bad influence on how your day is going to be. Especially like being a student. I used to have exams, and for someone like me, I think most of the students would relate to this, but I don't know. I think I just exceed that sort of thing where I would just leave every single thing to the last minute, get everything done, and just go take the exam. I've done that, and that's not good. It really, because I remember I just slept for like, I used to sleep for like 2 hours, and at that time it was Ramadan as well, so had to fast, had to go take the exam, and just to like maintain all that thing, it's really it's really stressful, and it really like changes up your whole mood and all that. And then your stress and physical health, that's, we're going to talk about stress and all that as well, like how stress is a good thing and a bad thing for you, and how your body sort of reacts to how stress is going to be perceived and how stress is going to be handled. And then there's mind-body practices. We are going to talk about this in detail. I've put some videos in there as well, so you can see what sort of practices are there. I would be happy to share that I've tried 1 to 2 of them, and they work. I agree to it. So yeah, there's a video that will probably explain better than I'm explaining. So enjoy the video.
It wasn't like it hit me all at once. I struggled with feelings of fear and worry over the years. When my doctor told me that the pain in my hands was caused by arthritis, those feelings continued to grow. I started to worry that I wouldn't be able to do the things I love, like gardening and playing the piano.
I started having panic attacks and feeling like I couldn't breathe. I already had asthma, which can make breathing hard anyway. I was so stressed that I had trouble falling asleep at night. I found myself so tired during the day that I could barely focus on my work. Never occurred to me that mental health and physical health were so closely connected. I guess because you go to different kinds of health professionals for help. But I saw a news story that made me realize we really shouldn't think of them as 2 different kinds of health.
We're joined today by Dr. Ellen Welch, a medical doctor who says we should be thinking about our health much more broadly. Doctor, what kinds of things besides our physical health are important?
Thank you for having me on today. And yes, that's correct. When we talk about someone who is healthy, we are talking about physical health, but also mental health, social well-being, and other resources a person needs to live a full life.
That sounds like a lot more than just curing someone when they have a fever.
You're right. Health isn't just the absence of disease. It also refers to a person's ability to bounce back from illness or other challenges in life. There are many factors that contribute to our mental and physical health. Some factors include a person's genetics, their environment, their relationships, their education, and their employment. These all impact a person's ability to lead a healthy life.
So what can our viewers do to improve the kind of health you're talking about?
Certainly, eating a healthy diet and getting regular exercise as directed by a physician are keys to good health. It is also important to have healthy coping skills when challenges come up in a job or a relationship. Having healthy social relationships can also contribute to a person's overall well-being, including their mental health.
Hearing that, doctor, helped me understand that my stress was doing more than just impacting my physical health. It was also starting to hurt my relationships, affecting how I spent my free time, and seemed to make me feel overwhelmed. In fact, learning that mental health is the way our thoughts, feelings, and behaviors affect our lives helped me realize I needed to address my ongoing stress as a health issue, both physical and mental. I talked about this with my doctor, and he connected me with a therapist. I still meet with my therapist from time to time. In addition to the diet, exercise, and physical checkups from my doctor, my therapist has helped me learn to manage my stress, develop healthy relationships, and a more positive attitude. Each and every day is filled with unique ups and downs, but understanding the link between my physical and mental health has made a big difference in my...
I hope you could hear the video, because in between I saw that there's some sort of audio problem, but I hope you could hear it. If not, I would just share the slides to you guys, and then you can take a look at the thing. Now we're going to talk about the I think we've talked about it already, but let me just go into details in the next slide. I'm just going to do this. Yeah. So in the video as well, if you could hear it, it's how you're sort of improving your physiological health by improving your psychological health as well. So if you heard it correctly, it was like a person having some sort of physiological defects or some sort of like disease. If they're referred to someone who can help them psychologically as well, it really makes a huge change. I've seen it very closely. I have a question. Please speak in Urdu